Welcome back to Fluvoxamine Frontiers, Battling COVID-19, where we are exploring the remarkable journey of fluvoxamine in the fight against a global pandemic. I'm your host, Dr. Soma Rohatgi, and I'm joined again by our brilliant guest, Saakshi Sharma. Today, we are diving into a pivotal moment in fluvoxamine's story, the Together trial, a landmark study that put this drug on the map as a potential COVID 19 treatment. Let's start with a quick science primer. Imagine a randomized controlled trial, or RCT, as a fair race. You have got two runners, fluvoxamine and a placebo, competing to see who can best protect patients from severe COVID 19. The RCT is designed to eliminate cheating or luck, ensuring the winner's victory is due to real skill. This rigorous setup is the gold standard for testing drugs, and it's how we know fluvoxamine's results are the real deal. So, how did fluvoxamines perform in this race? Let's find out. Saakshi, let's start things off. What were the key findings of the Together trial for fluvoxamine, and why did they make such a splash in the scientific community?
Thanks, Dr. Soma. And I really love the race analogy. It really captures the stakes. The Together trial, conducted in Brazil and published in 2021, was a game changer. It was a large-scale, randomized, double-blind study involving over 1,400 high-risk COVID-19 outpatients. The key finding was that fluvoxamine, given at 100 milligrams twice daily for 10 days, reduced the need for hospitalization by about 32% compared to placebo. For patients who adhered fully to the treatment, the reduction was even more striking, closer to 66%. This was huge because it showed that a cheap, widely available drug could keep people out of overwhelmed hospitals during the pandemic's peak. The splash came from the trial's rigor and the fact that fluvoxamine, a psychiatric drug, was showing real-world impact against a viral illness, which was a paradigm shift for many researchers.
That's truly incredible. A mental health drug crossing the finish line in a COVID 19 race. The Together trial faced a lot of skepticism given fluvoxamine's unconventional role. How did its design address those biases and doubts to build trust in the results?
Absolutely, Dr. Soma. Skepticism was high because fluvoxamine wasn't an antiviral. It was an SSRI. So, people questioned whether it could really work. The Together trial's design was meticulous in addressing this. First, it was randomized, meaning patients were randomly assigned to fluvoxamine or placebo, eliminating selection bias. It was also double-blind, so neither patients nor doctors knew who got what, preventing placebo effects or unconscious bias in care. The trial focused on high-risk patients, those with conditions like diabetes or obesity, ensuring that the results were relevant to the most vulnerable to severe COVID-19. They also used clear and measurable outcomes like hospitalizations or the need for extended medical observation. By sticking to these gold standard methods, the trial silenced many critics, showing that fluvoxamine's effects were not just a fluke, but grounded in solid evidence.
Thank you, Saakshi. So it was like setting up a race with clear rules, impartial judges, and a level track to ensure fairness. But no trial is perfect. What limitations did the Together trial face, particularly in terms of scaling fluvoxamine's use to a broader population?
You're right, Dr. Soma. No trial is without hurdles. The Together trial was a triumph, but it had limitations that affected scalability. First of all, It was conducted primarily in Brazil, so questions arose about whether the results would hold in different populations with varying healthcare systems or COVID-19 strains. Secondly, the trial focused on early treatment. Patients had to start fluvoxamine within 7 days of symptoms. In real world settings, getting patients diagnosed and treated that quickly can be challenging, especially in areas with limited testing. Another issue was adherence. Some patients did not complete a full 10-day course due to side effects such as nausea, which weakened the results for those groups. And finally, fluvoxamine's interactions with other drugs, due to its effect on liver enzymes, raised concerns for patients on multiple medications. Scaling up requires education for doctors, accessible diagnostics, and strategies to manage side effects, which are tough in resource strapped settings.
That's a great point. Winning the race is one thing, but getting the whole team to the track is another challenge. Fluvoxamine ran the race of evidence in the Together trial, speeding past skepticism and crossing the finish line with proof of its worth. Like a determined runner in a fair and rigorous race, it showed it could reduce hospitalizations and save lives, earning its place as a contender in the fight against COVID 19. Thank you, Saakshi, for breaking down this pivotal trial with such clarity. To all the listeners, stay tuned for more insights on fluvoxamine's journey. Keep your curiosity alive. Science always has more to reveal.